All right. Hello there, I'm Dr. Austin Fontenot, and today we're going to talk about sleeping, which I personally love sleeping. So, how much do we need? Most people recognize and know that we need 7 to 9 hours per night, depending on the individual. I personally feel useless if I get any less than 8. Over time, chronic sleep debt can contribute to fatigue, but not just like tired fatigue, like your whole body fatigue doesn't want to work right. It increases stress levels, cortisol levels go up and down at inappropriate times, and it increases your irritability. It takes a lot less stimulus to set you off and make you frustrated. It reduces your attention span and makes your memory worse. So for you students, not a good idea to shut yourself off on sleep there. One way to combat the effects of sleep deprivation is with napping. So this table here shows the benefits of sleeping at these certain time intervals. I think anything more than 30 minutes, you're probably going to be a little bit groggy afterwards, but there's still benefits there, and it can still close the gap on the sleep deprivation. So, suggestions. I suggest you minimize or avoid stimulants or drugs such as alcohol, not a stimulant, caffeine containing beverages and foods such as chocolate, and certain medications. I'm not going into any specifics there. And complete your aerobic exercise at least 3 hours before bedtime. That exercise boosts your adrenaline levels and makes it more difficult to settle down. Reduce nighttime tension and anxiety. So I encourage you not to watch the news before sleep. Try to pay your bills in the morning. Don't stress about finances at night. Avoid arguments before bedtime. Do your best. Avoid repeated negative judgments about the fact that you were unable to sleep. Self-judgment. Don't be so hard on yourself. Gotta let it go. Use positive self-talk phrases regarding your ability to relax and fall asleep. I can fall asleep. I can fall asleep. I can relax. I will relax. Try writing in your journal or get a journal. Any disturbing thoughts that are running through your mind, write them out of there. Schedule a time within the next few days to deal with whatever is troubling you. If you're having trouble getting sleep in, schedule it. Set a reminder, set a timer. At that time frame, shut off what you're doing, get ready for bed. Try to be consistent. Go to sleep, wake up at the same time every day as much as possible. Begin preparing for bed 30 minutes before. You need to give your body time to settle down. Avoid getting in bed after 11 p.m. Avoid late afternoon and evening naps and naps longer than 45 minutes. Avoid large meals or spicy food before bed. Don't need to give yourself any reflux type symptoms while you're trying to sleep. Finish eating at least 3 hours before bedtime. Again, same thing. And avoid drinking more than 8 ounces of fluid before bed. Don't want to interrupt yourself with getting up to pee if you don't have to. If you're having trouble falling asleep, don't lay there more than 20, 30 minutes trying to do so. Leave the bedroom, read, do some relaxation techniques or some breathing techniques. consider reading a good neutral book under low light, not a stressful book or a scary book. If using a tablet or phone for reading, use nighttime settings with the lowest possible brightness. That brightness, real bright light, tricks your pituitary into thinking it's daytime. Try writing recurrent thoughts to keep you awake in a journal, and consider counseling. Don't use a table lamp for reading. Instead, use an HUD light or other small reading light. You can read this. If you want to read it all, just pause the screen. You want to minimize the light in your room. Again, same thing. I think I said tricks your pituitary, tricks your pineal gland. Made a mistake in the last slide. Try, if you can, keep your head away from any electromagnetic fields, like your cell phone. If you can, maybe put your cell phone in the bathroom or away from you to where you actually have to physically get up to get it. If you're sensitive to allergens, maybe consider a hypoallergenic pillow. You don't need to be sniffling and sneezing during the nighttime. Some more stuff you can read. Pause the screen, take a look at it. And supplements. Supplements can certainly help. Melatonin, this is produced by your pineal gland, but maybe you could use a little boost, 1 to 5 milligrams to fall asleep, or 5 to 20 milligrams time released to stay asleep. 5-hydroxytryptophan, 1 to 200 milligrams 1 hour before bedtime. Taurine, 500 to 2,000 before bedtime. Magnesium, 200 to 400 milligrams. Just good to take for most people most of the time. So just go ahead and do yourself a favor and get some magnesium. If you want to decrease your nighttime cortisol levels, if you find that you're wide awake when it's more appropriate to be sleepy, that could be your cortisol level too high, too late. So consider using ashwagandha, which is an adrenal adaptogen, phosphatidylserine, lactium casein, decapeptide, L-theanine, other calming herbs, skullcap, and Rehmannia are also good. Establish an evening herbal tea habit, such as lemon balm and passion flower, to support relaxation and sleep onset. And lastly, maybe consider light therapy in the morning. Consider a half-hour exposure to a blue or 10,000 lux bright light first thing in the morning. That's if you find yourself going to bed too late and want to shift to an earlier bedtime. That'll help boost cortisol levels in the morning and less so late in the evening. So that's all the slides I have for you. Thanks for watching. Again, be safe, stay healthy, and I will talk to you all soon.